Let's begin part 2 of newborn stabilization. We'll begin with the APGAR score. What the APGAR is evaluating is the oxygenation and neurostatus of the baby. The APGAR does not correlate with anything in terms of being an acronym. It's named after the physician who developed it. But what it rates is the baby's ability to breathe, what the reflexes are like, what the heart rate is, the color, and muscle tone of the baby. A good APGAR, which would be between a 7 and a 10, requires very little in terms of resuscitation. You basically dry the baby, rub it a little bit, talk to the baby, and they're good to go. But babies who have absent pulse, very flaccid, looking pale, not breathing on their own, these kids are in trouble. Now, as a novice, you'll wonder, how can that nurse have APGAR'd that baby so quickly? Because at 1 minute, it goes by so fast in that delivery room, you're thinking, holy cow, how did they even do it? Well, if you have a baby who is crying to beat the band and is flailing around and fighting everything that you do, you know it has a heart rate over 100. You know he's breathing fine. So that's why we can do it so quickly. We know what to look for, and so generally they're just knocking off a point for color if the baby has acrocyanosis. So don't feel intimidated by this. Just know what it is we're looking for. So the things you will see is acrocyanosis, which I keep saying, which is the blueness. Look at this baby on the far left. Boy, those are really blue feet. But you also will notice that this baby has vernix, that white cheesy substance that is on the baby's skin. This is a wonderful lubricant for the baby while in utero, and we don't have to take 100% of it off when we give that bath. So we use the bulb syringe. You can use bulb suction if needed. When you look at this baby on the right, he's pretty blue, but look at those extremities. Nice and flexed, he's crying. I'll bet you anything his heart rate's well above 100. And it's good for the baby to cry. They're getting the fluid out of their lungs. Don't let it bother you. So a baby who needs intervention, if they have an APGAR score less than 7 or 8, their respiratory rate is below 30 or above 60. Some of these babies are breathing 80 times a minute. That is very difficult to count. If they're retracting or grunting, and that grunting, you can walk into the nursery or you walk into a delivery room as a nursery nurse because you're running back and forth, and you walk in and you hear this, that kid's in trouble. Take it off the mother, put it under the warmer, check the temperature, do an assessment, see what's going on. Is the apical pulse below 110 or above 160? The skin temp. If they get cold, they all of a sudden start going downhill, so we need to warm them up. And babies that are preterm or postterm, they may need additional interventions. Are they small for gestational age or large for gestational age? Those babies need to have a blood sugar done. And then, are there any obvious congenital anomalies that involve open areas of the skin? Because we need to take care of those immediately. So at 5 minutes, which once again is going to go by very quickly, you need to do the second APGAR. You're going to do a very quick head-to-toe assessment, basically just making sure this kid looks okay. We must apply ID bands. The baby gets 2, the mother gets 1, and then the father or significant other gets another. And we ID this baby with father and or mother and the baby with a number, the name, the date, and the time of the birth. Give feedback to the parents, and if the baby's under the warmer, have the dad be right there. Let him know, oh, your baby's doing great, or we're doing this because the baby doesn't want to do that. But get them involved. Allow for pictures. And so when you're worried about, oh, where do I fit into the picture? You can be the photographer. Next thing you know, you're the best friend because you allowed for some very precious moments to be recorded in history. We want to begin skin to skin contact as soon as possible, but if the baby isn't stable, we're going to keep him or her under the warmer. So when we talk skin to skin, this is what we call the baby friendly initiative. We put the baby on the skin of the mother. They will find their way to the breast. They will calm down. They will start becoming alert. They love the smell of the mother and the sound of the heartbeat and the warmth. If the mother doesn't feel up to holding the baby, then we put this baby skin to skin with the dad. We will initiate breastfeeding as soon as possible after delivery, but make sure you keep the baby warm. So when you look at this picture, you can see this baby is ready to just latch on. But you see all that hair on the head? That's very shiny. This baby needs a hat to make sure that he stays warm enough while on mother. And then we'll use a bath blanket or a baby blanket and cover up the baby. So this ends part 2.